just had a great conversation with a patient about knees over toes and is that correct? We're dealing with a meniscus repair patient who is several months post-op, so he's progressing through his recovery and adding exercise. And I'm going to show you what his lunge walk looked like. So go ahead and go. So take a look and see what knee you think is the post-op meniscus repair.
Over there.
And then turn around and go back. So as you can see, when he steps with his left, knee comes forward over toes. Right knee has a hard time coming forward over toes because he still lacks dorsiflexion. And then turn around and come back. So what our goal is to have this knee look like this knee. So he has full dorsiflexion, into knee flexion, more hip flexion. So the long or the short answer for his question is yes, your knee should go over your toes. That's why the good leg does what it's supposed to. We're still working on getting full range of motion through full strength and facilitation in order to get more dorsiflexion and knee flexion and make it comfortable because of increased proprioception through neuromuscular facilitation on the post-op knee.